Welcome to all you marvelous people who have braved the winds and waves to come here tonight to join us in the opening session of the spring workshop conference of the Frederick S. Pardee Center for the Study of the Longer Range Future, a center which we owe to the generosity and imagination of Frederick S. Pardee, a marvelous man who is with us at our last conference, and I hope will join us again for future ones. At this point, it was intended that we would have some remarks by Paul Streeton, a great man who taught years ago at Boston University, who isn't able to be with us tonight, but very kindly has sent a copy of what his remarks would have been to all of you. They're being distributed. Remarks which show the breadth of his vision. He's a splendid man, a splendid thinker, and his remarks are well worth considering. We will, however, have brief remarks from two of our colleagues tonight, and to begin with, from Dilip Mukherjee, who's the director of the Institute for Economic Development here at Boston University, and who is co-sponsor of this evening's meeting. So I will turn these two special microphones. We've been warned about them. One is for one thing. I will turn them over to Dilip.
Okay, so I'm Dilip Mukherjee, Institute for Economic Development, which is a research center specializing in economic development, which is within the Department of Economics, and my colleague John Harris, also from the Institute. Paul Streeton was a professor in our department and was, in fact, the founder of the World Development Institute, and which was one of the institutes that was merged with others to form this Institute for Development. And we were very much hoping that Paul would be here to speak today, partly because he's one of the pioneers of the concept of human development. But unfortunately, he's not well enough to be here. And David and Maddie asked me if I would say a few things on the subject. So last night, when I sat down to think about economic development, human development, and happiness, I said, should I read what Paul has written? And I said no, because last time we met Paul at a Pardee Center conference, I was trying to convince Paul that even though he was sort of skeptical about what we of the young generation were up to, that we basically held the same views. So I wanted to sort of test that and said, what would I say on the topic? And then I wrote down some notes. And then this afternoon, I sat down and read what he had written. And I'm pleased to say that though Paul is not here to defend himself, that actually I think our views are very much in common. So I think there is some kind of consensus amongst economists on this subject of economic development and human development. So let me just say a few brief remarks about that consensus. It's new. About 15 years ago, or sort of, when you think of periods beyond 2 decades or so, there was this sort of dichotomy between people who believed in economic development as measured by growth in per capita income, that being the sole measure of progress, and people who felt that was just too narrow. And so let me just read paragraphs from a famous paper by Robert Lucas, who won the Nobel Prize in economics. A couple of years ago, he wrote a famous article on economic development in which he said, by the problem of economic development, I mean simply the problem of accounting for the observed pattern across countries and across time in levels and rates of growth of per capita income. This may seem too narrow a definition, and perhaps it is, but thinking about income patterns will necessarily involve us in thinking about many other aspects of societies too. So I would suggest that we withhold judgment on the scope of this definition until we have a clearer idea where it leads us. Contrasted to that is a paragraph that I take from something that Paul wrote. And this is often cited as the alternative view. We should never write, this is Paul, we should never lose sight of the ultimate purpose of the exercise to treat men and women as ends, to improve the human condition, to enlarge people's choices. A unity of interests would exist if there were rigid links between economic production as measured by income per head and human development reflected by human indicators such as life expectancy or literacy, or achievements such as self-respect, not easily measured. But these two sets of indicators are not very closely related. So this debate, I think, sort of continued for some time, having sort of got underway, I think, 15 or 20 years ago. And I think while earlier the notion was that both are right in a way, perhaps Lucas is right in the broad sweep of things. If you try to understand why human development is better in any two countries randomly chosen, okay, the best single predictor is probably going to be per capita income. So per capita income is perhaps not the only thing that matters, but if you have to select one factor amongst everything else, and you want to explain differences in human development across countries. So perhaps if that point of view is correct, then if you take care of economic growth, human development will take care of itself. The alternative view, which is Paul's, is that you see enormous differences in human development amongst countries with the same level of per capita income. And these reflect sort of profound differences in the structure of those societies. And there is still a very active element of choice that exists in terms of design of social structures, social policies, government policies, and so on, which affects the extent of human development at any given level of per capita income. And that is the ultimate objective of economic development. So if you were to compare Eastern European countries in the late 80s with Western European countries, you would often find measures of human development in Eastern Europe much more advanced than in Western Europe, while the per capita income comparisons would go the other way. Or you could find countries such as Sri Lanka or southern state of Kerala in India with remarkable levels of human development comparable to those in New York, and per capita income levels, on the other hand, closer to those of the poorest countries in the world. You also have countries like South Africa and Brazil with middle-income countries, much higher levels of per capita income, but with abysmally low levels of human development for large numbers of people. Now, in the wake of that debate, I suppose there was the evolution of the Washington Consensus, is a term coined by John Williamson, and a large part economic policy of the World Bank, the International Monetary Fund, and so on, for some time, converged on that as a way of dealing with problems of development. And if you look now at the elements of the Washington Consensus, a lot of those are actually not that much in dispute amongst professional economists. Reasonable levels of debt, lower inflation, sound macroeconomic policies. Nobody really disputes that. What is really under dispute is what the Washington Consensus left out. And what it left out was a concern for reducing inequality and poverty. What it left out was a direct approach to dealing with problems of human development. Now, I think, in the last 4 or 5 years, my perception is that, at least amongst economists, that debate has sort of been resolved, and the one who won was Paul Streeton. So if you look at academic research amongst economists today, I think the general consensus is that human development is not only valuable for its own sake, but also going beyond that, lots and lots of arguments, theoretical arguments, empirical arguments, and so on, that human development may in fact be instrumental for economic development. And sort of, just to give you some examples, the notion of market-driven growth and the different experiences of East Asia and Latin America. The notion is that East Asia has managed to benefit much more from market-driven development than Latin America has, partly because East Asia has been much more egalitarian as a society. The process of development was started with a massive dose of land reforms and widespread increase of primary education. Lucas's article actually restored to education an important role in the process of economic development. And in fact, there's been a substantial growth in literature in economic growth, trying to explain differences in growth across countries. And that is difficult to account for on the basis only of differences in savings and investment, which was the traditional approach of economists. And so Lucas argued, as did many others, that you had to think of human capital as an added dimension of capital. And unless you did that, so differences in education and literacy accounted for a significant part of the differences in growth. Beyond that as well, I think in the last 4 or 5 years, we have a lot of literature now arguing that high inequality and poverty restricts human capital development, restricts agricultural growth, because small farmers are often more productive and dynamic than large farmers, that high inequality and poverty can create environmental disasters. It's associated with problems of overpopulation, problems with public health, high levels of crime, creates political instability, breeds religious fanaticism, terrorism, and so on. So there may be actually a very good instrumental argument for promoting human development, even though one may be interested in economic development more naturally. So now I think I see, at least amongst academic economists, a sort of evolving consensus that human development has to be tackled head on. And if you have an unequal society to start with, it's not going to happen through the market. So you need an activist role for states and international organizations in trying to improve human development. But this, on the other hand, raises serious governance problems, because the delivery of health and social services and education and roads and public health and so on is subject to high levels of corruption and problems of weak states. And these seem to be especially high in societies with high levels of inequality and poverty and low levels of human development. So the solutions are not easy. But I think the consensus is that one has to develop innovative mechanisms of accountability for the public sector, encourage democracy as a way of promoting accountability, of encouraging participative decision-making, experimentation with decentralization to local communities, to non-governmental organizations, to citizen watchdog bodies, and so on. So as a result of all this, economists have, I think, embarked quite definitively on a wider dialogue with politics, with political scientists. But, you know, development involves much more than just economic development and human development. The third topic in this conference is the pursuit of happiness, and economists belonging to the dismal science know nothing whatsoever about happiness. So there are broader issues of community, of culture, of ethics. I think one of the pages in Paul's article lists all the things that you may consider important. It just goes on and on and on, and clearly happiness counts for much more. And I think economists are forced to be humble and say that, well, we can just only bite off what we can chew. So I think economists, therefore, are interested now in a wider dialogue, and it's in that spirit that I think this conference is going to be very interesting for me and for John, and look forward to the dialogue.
We will hear next from our distinguished new colleague, Gerald Kusch, who has become Assistant Provost and Associate Dean for Public Health here at Boston University, and with whom we look forward to working on many, many great projects.
Well, thank you very much, David. It's a pleasure to be here, and I seized the opportunity to have a chance to say a few words tonight, and I realize that the job of speaking after dinner is to be brief. It's the most succinct challenge that we face, because I wanted to introduce myself to my colleagues from BU. I've been here at BU for about 3 months now. Is there any significance that this is April Fool's Day? I don't know. And I came here from the National Institutes of Health. And so when I think about the pursuit of happiness, it was leaving the administration. I joined the NIH in 1998. I was a professor of medicine at Tufts and the chief of infectious disease. I'm a clinician. I'm not going to talk from the economic perspective. I'm going to talk about health, because health is at the center of human development and of happiness. If you don't have healthy people, there is no quality of life. And the joining the NIH in 1998, the director was Harold Varmus, Nobel laureate, and a man of great vision. And things have gone downhill from there. And I think at the present time, we face a real challenge in academic freedom within the administration and the imposition of politics and ideology in our research agenda. But that's not what I want to talk about. What I want to talk about stems from my own odyssey, starting out as a physician scientist, a clinician, interested in traveling. So I got interested in international medicine and health. And as distasteful as it might sound, I cut my teeth on cholera and dysentery, major challenges in the developing world, major killers of children, major impact on nutritional status and growth and development and subsequent productivity as adults and impacts on society. We're at a crossroads at the present time in this new millennium. Scientifically, we're at a crossroads where biomedical sciences, which is where I have spent most of my life applying molecular cellular biology to problems, health problems in the developing world, looking for solutions, really has to meet the social sciences and to form not just a marriage, but to form a new discipline. We have to figure out how to incorporate social science, behavioral science, and the biomedical sciences together and create new scientific frontiers. And in some ways, this is represented by the challenge of sustainable development. We have, as the substrate, increasing knowledge and increasing disparities, and you touched on some of those disparities. So if I think back on the last century, scientifically and in medicine, it was a century, and particularly the last 50 years, it was a century of incredible discovery. In medicine, we created absolutely new areas that had never existed before. The techniques in imaging for diagnosis, unbelievable marriage of physics, mathematics, and biology. And we created the science of immunology. Molecular and cellular biology grew up. We understand how cells within the body are a sociological phenomenon. They talk to one another. They have to relate to one another. They have to figure out how to live together and do things together. And so this biology and cell signaling and crosstalk between cells has been absolutely incredible. The genetic sciences, unbelievable progress. 50 years ago, the identification of DNA as the molecule of heredity, and 50 years later, sequencing the entire human genome. I'm interested in malaria. We now have the position of having the human genome, the genome of the mosquito, and the genome of the parasite. If that isn't an opportunity to make great progress, I don't know what is. And then we've taken off from there with the melding of mathematics and biology and computational biology being applied now to the genetics revolution, and the next revolution is what do genes do? They make proteins. And what do those proteins do? That's the frontier. And we're going to have designer drugs. We're going to be able to take you and you, same condition, but your biology is different. You'll get drug A because it'll do the job and not be toxic, and you'll get drug B. And we'll be able to do that on the basis of your genome. So absolutely incredible half century. You couldn't ask for better in science. And what's happened in society? Increasing disparities in health. When we look at the investments in research, increasing disparities in health research between the rich and the poor. We've discovered that knowledge doesn't lead to solutions necessarily. There are more neglected diseases, and these are primarily of the poor, in developing countries. We've failed to effectively use what effective technology we have. And in medicine, we've developed a system of production of drugs and vaccines and medical devices that is a for-profit industry. They go where the market is, and if the market isn't, they don't go. And their fiduciary responsibility is to their taxpayer, to their stockholder. So if we were to invent a pharmaceutical industry now and our interest was in global equity, would we invent the one that we have? Absolutely not. But that's what we're stuck with, and we have to deal with it. But if we don't address some of these problems, what's the prospect for the next 50 years? Economists notwithstanding. There will be more old. There will be more young, both unproductive in terms of economic, creating economic growth. There'll be more poor. There'll be more hungry. There'll be more pollution. There'll be more crowding. There'll be more disparities in resources, availability and use. There'll be greater risk of communicable diseases because of all of these conditions. And there'll be more resentment, more political instability, more civil violence, war, and social disruption. So I can put health at the center of everything. And we're in an interesting circumstance because I think we're beginning to understand that the paradigms of development of the last 50 years didn't work. It didn't work because the investments of the World Bank in dams and big projects and industrial parks, yes, it created wealth. Yes, the GDP did go up, but it was concentrated in the hands of very few. And the productive element of society, those at the lower stratum, did not advance. In fact, the disparities have grown greater. So they didn't gain from the wealth creation, which theoretically should have allowed them to buy better health. They got sicker and they got poorer. And yet there was economic growth happening. So the new paradigm that is beginning to emerge is that if you want economic development, you invest in the health of your workers. And you don't start when they're 20, you start when they're born. If you don't have healthy children, their cognitive development is impaired. When they reach the age of working, their physical status is impaired. So, Mr. Pardee, you're interested in the future. The future is also the present. The kids of today, who were born today, in 35 years will be your workforce. The adolescents who are 15 or 20 will be your leaders. If they're not healthy and able to fulfill their genetic potential, you don't have a successful society. So where are we at the present time? Over 1 billion people live on less than $1 a day. Close to 3 billion live on less than $2 a day of income. 1 out of 6 are chronically hungry. Expenditures on health in developing countries at the maximum $10 per capita for everything. The minimum package for children alone is about $40 per capita. So you've got poor societies with poor investments in their human capital. It's no wonder that the health systems fail and the health status of the population does not improve. Population, we're at 6 billion now and we're growing. Will it stabilize at 9 billion? I don't know. Can we feed them? I don't know. We certainly can't make a stab at it if we don't employ all the modern technology and genetically modified organisms. The best land is already being cultivated. The rest of the land that could be used is poor and takes enormous investments in chemicals. And the result of that is increasing pollution. And this projection of 9 billion in 50 years is even with the devastating toll of AIDS. All that AIDS does is blunt the growth of the population. It doesn't stop it from growing. The environment, a disaster. Increasing degradation due to primarily human actions. I was in New York earlier this week at the Earth Institute, part of the 250th anniversary of Columbia University, and there was a symposium on the state of the planet. Most of you must know Jeff Sachs, and this was Jeff Sachs' new institute, and so he always thinks big. So the state of the planet, and the issues were energy, food, water, and health being considered. And the environment is at the center of all of this. One of the speakers said, this century will be known as the century of the environment. We'll either fix it, we'll either get it right, or our kids and our kids' kids face a bleak future. Civil society is in disaster. All around the world. Civil wars, genocide, displaced persons, refugees, migration, failed states all over the place. The only kind of regime change I think we need is in Washington. We're making the wrong investments. We're investing in arms. We're not giving a helping hand. And in health, the burden of disease in the developing world is astounding. 95% of the global disease burden is in the developing world. Life expectancy in 5 African countries, which had increased over the last 50 years. This is life expectancy at birth, one of the great measures of how well a society is doing, had increased to 60, 65 years. It's now below 40 years. It's back where they were 50 years ago. Others are falling off the curve. The gains of the last 3 decades have absolutely been wiped out. And within this, there's 8 million preventable childhood deaths a year if we just applied current technology, immunization, for example. In 15 or 20 years, there'll be 10 million tobacco-related deaths per year, almost all of them in the developing world, as the tobacco industries now export everything they know about marketing to the developing world. And yet, since I think health is at the center of things, we have to realize that health is not a purview of physicians, of clinicians, and it's not affected by science alone. Political stability, population growth, the demographics, the economic situation, education in populations, the ability to apply preventive medicine, public health measures, rather than investing in curative medicine, which is expensive and too late. The lack of healthcare delivery systems, and the lack of any money to pay for it in these countries. So we live in a world that is characterized by globalization, and globalization is really more than economics and trade. It really, we've seen this, events in one part of the world affect the rest of the world. Think about SARS originating in southern China. This great confluence of birds, chickens and ducks, and people. This is the perfect incubator for selecting new viral strains. This is where all the new influenza comes from. This is where the next 1918 strain of influenza will come from. And it very quickly moves around the world. And if you happen to be Canadian and lived in Toronto, you know what a huge economic impact it has had. We're lucky. The SARS virus was a punk virus. It could be handled by the technology, public health technology of 50 years ago. Wash your hands and wear a mask. But that's not going to be the case with the other bad things that are likely to happen. People are moving around very quickly and rapidly. They take their diseases. The insects come with them that transmit disease, and the agents come with them. Global warming is real. It's got many predicted effects, and even on the conservative side, it sounds pretty bad. couple that with environmental degradation. This creates the opportunity for new ecological relationships between microorganisms, between insects that may transmit them, between animals that may harbor them, and human populations that are moving into land that they never were intended to move into. And this is now creating new species. So Michael Crichton, you were probably right. You just didn't understand how right you were. We have to be thinking ecologically. Health no longer can be isolated, and certainly in the way that we've thought about it here. We have neglected surveillance in public health. The World Health Organization, which could do some things, is absolutely handicapped, primarily by our government. We have absolutely insisted that the budget not grow in dollars. So it's constantly buying less. And we've insisted on paying less of that burden ourselves. And I can tell you, having been on the inside of the administration, we would like to control the agenda at WHO to make sure it lines up with the administration's agenda. So we've got a problem, and my whole life has been dedicated to the application of science to try to solve some of these problems. Donald Kennedy, who's the editor of Science magazine, wrote an editorial a year ago about an epidemic of politics. And he was talking about the imposition of political decisions from the administration into the selection of people to serve on the advisory committees. And I'm obviously most familiar with those in biomedicine and at the National Institutes of Health. It was a pretty strong indictment of what was going on. Some of you may have seen the report of the Union of Concerned Scientists last month, which talked about the multiple examples of the imposition of politics and ideology into science. And the science advisor to the president, John Marburger, who used to be a great scientist, a physicist, was the director of the Brookhaven Lab, chose to respond to the Union report and the 20 Nobel laureates and the 20 Presidential Medal of Science winners who supported it by trivializing them, by saying that they really didn't understand that these were absolutely unconnected events. He didn't deny that anything that's reported in the Union's report true. He simply said they really don't fit a pattern of administration imposition. Right, as my daughter would say. So Don Kennedy talked about an epidemic of politics. I think we've identified the cause. Some of you may know of the virus that comes out of Africa called Marburg virus. It's like Ebola. It causes the same kind of a disease, Marburg disease. I think we now have Marburger disease, where we trivialize. We don't address the key issues directly and head on. And if we don't do this quickly, if we don't insist on the sanctity of science and investigation, free of the imposition of politics, to put the evidence on the table to then make the policies, we are in trouble as academics, we are in trouble as a society. And so what C.P. Snow used to talk about of the two cultures of science and society is now getting even more complicated by the other two cultures of science and security and academic freedom. These are the problems that we face. I think you will find that people in the health arena want to work collaboratively, want to figure out how to solve some of these problems. I think we realize that without this broader constituency that you all represent, it can't be done. And if we don't do it, if we don't solve it, then there will be more September 11s and other such tragedies, and it will be our children and their children who suffer. So I met David a month ago. We had a conversation. I'm looking to see who's around at Boston University to get together and do some interesting things in promoting health and in the most effective manner that we can throughout the world. David told me about this conference. I managed to get myself invited, and then managed to get myself an opportunity to talk a little bit to you because I'm really excited about listening tomorrow, so I figured I'd get my talking out of the way tonight. Thank you very much.
So thank you, Jerry, and thank you, Dilip, for starting this conference in such a lively and informative way.